Hello, everybody. Welcome to the Academy of Elite Doctors podcast, where we reflect with the humility and honesty and what it is truly means to be a doctor. Hi, I'm Dr. A.M. Thirinjanam, Senior Interventional Cardiologist. And today we are exploring a topic that sits at the very heart of our profession. What are the character, qualities, skills, intelligence, vision, empathy, and leadership that define an ideal, good, and ethical doctor? This is not about perfection, it is about direction. Not about being flawless, but about continually aligning ourselves with the highest standards of our noble profession. So, whether you are a medical student, a resident, a seasoned consultant, or a healthcare leader, I invite you to take a quiet, honest look at the doctor you are and the doctor you want to become. The foundation of a good doctor, character and ethics. Let us begin with the foundation, character and ethics. Before we speak of technical skills, intelligence, or titles, we must ask, who am I when no one is looking? What decision do I make when there is no applause and no one to impress? An ethical doctor is anchored by a few non negotiables. Number one, integrity. Saying the truth, even when it is uncomfortable, not exaggerating outcomes, not promising what we cannot deliver, not hiding complications, accountability. Owning our decisions. If a mistake occurs, we do not look for someone to blame. We look what we learn and how we can prevent it in the future. Justice and fairness. Treating every patient with equal respect, not based on social status, income, background, or ability to pay. Confidentiality and respect for autonomy. Protecting our patients' privacy and respecting their right to make informed decisions about their own bodies and lives. You and I know that it is not always easy. We face time pressure, system failures, financial constraints, and sometimes even conflicting interests. An ideal doctor is not someone who never feels these pressures, but someone who consistently returns to ethical principles as the final guide. When we sign prescriptions, when we consent our patients for surgery, when we share bad news, our ethical character speaks even louder than our clinical words. Clinical excellence, the second pillar of our ideal doctor. Good intentions alone cannot save lives. Our patients trust not only our hearts, but also our hands and minds. Key components are here: sound medical knowledge, updated, evidence based, not stuck in what we learned 10, 20, 30, or 50 years back. Diagnostic reasoning and clinical judgment, the ability to gather information, recognize patterns, question our own biases, and think both broadly and deeply before arriving at a diagnosis. Technical skills, whether it is performing a physical examination, inserting a central line, interpreting images, or operating in theaters. An ideal doctor practices, refines, and respects these skills. Situational intelligence, knowing when to escalate care, when to ask for help, when to say, I need a second opinion, and when to step back and reassess instead of rushing. Let me read you a short reflection many of us might identify with. In my early years, I thought being a good doctor meant always knowing the answer with the experience. I realized it means knowing when I don't know and having the humility and courage to seek help. True medical intelligence is not arrogance, it is discipline, thinking, continuous learning, and the humility to recognize the limits of our knowledge. The human core is empathy, compassion, and communication. Now, we come to what patients often remember most, how we made them feel. An ideal doctor combines clinical skills with a deep humanity. Empathy is the ability to understand and feel the patient's situation from their perspective. Compassion is empathy translated into action, into kindness, patience, and support. We demonstrate empathy when we sit down instead of standing over patient. Listen without rushing to interrupt. Allow silence when they are processing difficult news. Acknowledge their fear, not only their disease. Our communication is as important as any procedure we perform. Using clear, simple language, avoiding unnecessary jargon, checking understanding. Can you tell me in your words what you have understood? Being honest but gentle when the news is not good. Involving family members appropriately with the patient's consent. Consider a simple example. Two doctors may give same diagnosis and the same treatment plan. One speaks hurriedly, avoids eye contact, and leaves questions unanswered. The other speaks slowly, sits at eye level, and ends with, I am here with you, and we will go through this step by step. Both are medically correct, but to the patient, only one feels like a truly good doctor. Thinking beyond the present vision. The ideal doctor is not only a good clinician today, but also a visionary for tomorrow. Vision appears in different forms. Preventive mindset. Thinking beyond curing disease to preventing it. Counseling about lifestyle. Screening. Early interventions. System thinking. Seeing how hospital policies, workflows, and communication patterns affect patient safety and outcomes. Innovation and adaptation. Being open to new technologies, new protocols, and new models of care, while critically evaluating them for safety and benefit. Contribution to science and education. Participating in research, quality improvement, teaching juniors, and sharing experiences to the whole system involves. Ask yourself, if every doctor in my institution practiced as I do, what kind of healthcare system would we have in 10 years? Our daily choices to cut corners or uphold standards shape the future of medicine more than we realize. Leadership and teamwork. Another hallmark of an ideal doctor is leadership. Not just positional leadership, but leadership in attitude and behavior. In modern healthcare, we are rarely alone. We work with nurses, technicians, therapists, pharmacists, administrators, and many others. A good doctor treats every member of the team with respect. A good doctor communicates clearly, especially during handover and emergencies. Listen to concerns raised by nurses and colleagues and takes them seriously. Remains calm in crisis, giving clear instructions without shouting or humiliating others. Protects juniors from unsafe workloads and inappropriate behavior. Leadership also means advocacy. Sometimes it is our responsibility to speak for patients who has no voice, to fight for necessary investigation, a crucial referral, or access to essential medication. When a doctor leads with dignity, kindness, and clarity, the entire team's performance improves and the patient care rises to a higher standard. Personal well-being and humility and lifelong growth is important aspect of an ethical doctor. Finally, an ethical doctor recognizes that we are human too. We get tired, we make mistakes, we carry emotional burdens from our patients' stories. A truly good doctor understands the importance of sleep, mental health, and healthy boundaries. seeking help when struggling with burnout, depression, or moral distress, reflects on difficult cases not to punish themselves but to learn and grow, apologizes when wrong and makes amends where possible. Humility is a powerful protector against both error and arrogance. The more we see in medicine, the more we should respect what we still do not know. Lifelong learning is not only about attending conferences and collecting certificates. It is about maintaining a curious, honest mind that asks after every day, what did I learn today? What could I have done better? We would want to for ourselves. As we come close to this podcast, let us summarize the portraits we have painted. An ideal, good, and ethical doctor is anchored in characters and ethics, competent and disciplined in knowledge and skills, deeply empathetic, compassionate, and an excellent communicator, visionary, thinking beyond today's case, tomorrow's system, a respectful leader and a reliable team member, committed to personal well being, humility, and a lifelong growth. Will we achieve this perfectly every day? Of course not. But every clinic, every ward, every night duty is an opportunity to move one step closer. Let me leave you with a simple reflection. Be the doctor you would trust with your own life and with the life of person you love most. If we hold that standard quietly in our hearts, our decisions, words, and behaviors will naturally move towards excellence. Thank you for joining me today on the Academy of Elite Doctors podcast. If this episode resonated with you, share with the colleagues, a student, or your friends in healthcare. Let us build a community of doctors committed not only to brilliant minds, but also to noble hearts. Until next time, I am Dr. A.M. Thurunyanam, Senior Interventional Cardiologist. Stay ethical, stay compassionate, and keep growing. Thank you.